their arms up and then all of a sudden they're weak. So one of the things they're coming in is for weakness, lots of different things, okay? So one of the things is you're going to do a quick screening on the upper and lower extremities. So can I have a volunteer real quick? Okay, so what you're going to do is, as you look at your description, what I'm looking for is, do they have like an upper motor nerve lesion or a lower motor, okay? So I'm just going to move your arm. So if I kind of move this, I can easily move this arm. I don't get any resistance. I don't get any contractions or contractual of the muscle. I get nothing, okay? And then one of the things I'm going to do is I'm going to have her, don't let me pull your arm down. So I'm contracting the arm muscle or her bicep, and then I'm going to let go and see how much control she has. Some people have no control, or they'll close. Okay? So that's a really easy, you want to do both arms. Okay? So that's the upper extremity. The lower extremity is, just lay over your head that way. I know you're skinny. Yeah. So what you do is, you're going to actually just have them relax the leg. And what you're going to do is you're just going to pull this leg up. Just relax your leg. And then, not your leg. You're going to kind of bend the leg, right? I'm going to bend it. Just relax. Bend the leg. It's hard on the bed because she has her shoe on. Can I take your shoe off? It kind of slides on the sheet a little better. And as I move that, I'm kind of seeing her, but then you actually just drop it. And people who they have a lesion, it'll kick. Okay? She can control it. She has great muscle control, right? And if it falls back smoothly, it's fine. That's it. I'm checking her tone. She's got great tone. Make sense? Check both legs. All right, sit. You can just sit here, actually. Scoot over a little bit. The next thing is we're checking your fine motor control. All right, we're checking our fine motor control. So easy way to do this is just have them, I want you to just tap, and then go ahead and get as fast as you can go. Good, so you just got good control. Go ahead and do that there. All right, next thing you want to do is, if you can, you don't have to do it because you can't touch the ground, but you want to do it with your feet and just have them tap on the ground, go as fast as you can go. And it's very controlled, fine motor movement. Good tone, good muscle tone. All right? The next one is strength. So you want to test for strength. And you will check, and you guys remember Dr. Sparks, but this is one of the things, is strength. You'll check the strength of every muscle when you're doing a good neurological exam. And I'm going to show you guys how to do this when we do musculoskeletal. But we're not going to go through this in the neuro exam. But this is how you record strength. So there's no movement. Okay? There's no contraction at all. There's a little bit of movement in the muscle. They can move a little bit, and they can kind of overcome gravity. Or not overcome gravity. A little bit of movement, they can't. So they can move to the side, or it can fall down. You can move it down. This one is they can have movement, and they can kind of go up against gravity. But they can't. So they can do it on their own, but they can't do it with any resistance. Most people that you're going to see that are healthy, that have no neurological, are like a 4. So they've injured their joint, they're definitely weak in that area because it hurts. So they are definitely weaker in that muscle. Maybe they tore the muscle or injured the muscle. And they can resist, but it's definitely not as strong as their other side. 5 out of 5 is normal strength for that patient. So it's equal bilaterally, 5 out of 5. So bicep. Bicep strength. Right? You're right. 5 out of 5. Equal bilateral. So that's checking tone. These are all the different groups you guys are going to test. Next one you're going to do is sensory. So we talked about this. So light touch, you can use your finger, or you can use a cotton swab. Okay. So have patient close eyes, lightly touch the back of hand, one side at a time, and then just do it bilaterally. Ask the patient, do you feel this, do you feel this? And ask them where you're touching it, so put your hands out. Close your eyes for me. Okay. Now tell me where I'm touching you. Okay. So I light touch. Okay. So for next one is pain, so sharp and dull. So the next thing you want to do is have them put their hands out, and you're going to check sharp and dull. So this is sharp, okay? I mean, that's dull. Sorry, what? This is sharp, and this is dull. Now I want you to tell me if you feel sharp and dull, okay? And what you want to do is really rotate. The sharper, sharp. Sharp. That's the point.
Oh. I was going to say sharp. She's like,
You were saying, I'm making sure it's intact.
oh,
Sharper, staying sharper.
Sharp. Roll. Sharp. Go. Go.
So that's what you're doing. I'm making sure that they're intact. That's why I do it multiple times. That'll help you in a few hours, just leave it in. All right. So that's your sharp and dull. Okay? All right. Do that hands and feet. Hands and feet. Vibratory sense, hands and feet. Start at the distal joint, and if it's abnormal, then move up. You really want to avoid the joint. You want to do it near the joint. Okay? Because right on the joint, it's bony. You don't want to put it right on a bony protrusion, because bone really is easy to feel. You're checking, is it intact? I don't care about the bone, right? That's not what I'm trying to do. Just put it near the joint. So, hands and feet, okay? Proprioception, I know that we talked about this. We talked about it with Dr. Neal showed this. Make sure when you hold the joint, don't hold it like this, okay? Because when I push up, the brain will tell you that it's up, because the sensation's on the bottom of the finger. It's obvious. So if I hold here and I do it, then it doesn't give the brain this common sense movement of, obviously it has to be up because I'm pushing on the bottom of your finger. Okay, so hold it on the side. 2-point discrimination. So our nerves actually in our hands are really, really good, so our 2-point discrimination is very close. So I have the ability to feel 2 points much better where our sensation is better, versus on my back, those 2 points are farther apart. But what you can do is, where is that? I had some, did I forget them? Paper clips?
Oh, we
passed them out.
around.
Okay, good, you have them. What you can do is take 2 paper clips, or even 1, and have 2 points. Best way to do it is make 2 points. So what you can do is on the hand, have them close their eyes and tell you if it's 1 point or 2 points, right? So you can see where it changes, that's the way I do it. Okay? There's lots of different, you can take 2, whatever, it doesn't matter. So you can measure that. 2-point discrimination. Graphesthesia, okay? This is, so what you're gonna do is you're gonna draw a letter or a number. I don't care what you do. But you're gonna take their hand. I'm gonna draw a letter or a number in your hand. You're gonna tell me what it is, okay? So I'm gonna have you close your eyes. Yes. Okay. And you do it in the other hand. I want you to tell me what number this is. Okay. No, close your eyes. Okay. Close your eyes. Tell me what number this is. Yes. I usually use 3. I usually use 3 and 8. I don't use 2. It's a really hard number to pick. So 3 and 8 are real common ones. I was messing with you. So that's graphesthesia. The next one is you're going to place 2 objects in the hand. So you can, and they can feel it as much as they want. Obviously you guys know what this is, but so you have them close their eyes, and I want you to tell me, I'm going to put something in your hand, you tell me what it is.
It's a paper clip.
So a common thing is you can put, close your eyes and tell me what this is.
A cigarette.
Yes. Exactly.
Sorry, it's a pin. Anything on your mind? I'm just kidding.
So you can do any of those things. That's a,
Do we do this in the feet or just the hands? What if you're having problems with the
if
feet?
you, yeah, feet is difficult. Just hands, just hands. But you could do it, sure. Why not? Why not?
You asking me? I don't know.
You could. Let's check in different things.
Oh, we can't be?
Absolutely. We just don't, I won't have you do it with a standardized patient. Where's the? Okay? Okay. So cortical sensory, there you go. Okay. So tactile extinction. So sometimes people will, they won't know one side of the body, right? So we're going to do tactile extinction. Do you mind setting up your hip? So what I'm going to do is, this is obviously a lesion. I'm going to touch you in 2 different points, each side of the body. And what I want you to do is I want you to tell me where I'm touching you, okay? So I may touch you once, twice, but I want you to tell me where I'm touching you at all times, okay? Close your eyes. Which side?
Oh, left side.
Okay.
Both. Left and right chin.
Okay.
Left wrist. Left shin, right wrist. Both wrist.
Right,
So I'm checking to make sure, you're just using one side to kind of throw them off, to make sure that they're not, but you're checking both, right? That's why I'm doing that. Okay, easy? Ta-da! All right. So we have gone through sensory, right? We've gone through tone. So let's practice those. And if you guys want to practice, I've got a lower.
Katie, is this off?
So it's